movement disorders, I have explained to you here. The problem will be aging. Most of the time, the problem will be aging or any ischemic or a hemorrhagic problem. A significant movement problem, quality of movement is the one which is a problem, whereas there is no problem with the muscle power or the voluntary control as such would not be a problem. Here, the problem is with the movement quality. Most of the time hypertonicity will be there, particularly rigidity type, but in case of a cerebellar lesion you will have hypotonicity. I told you why, because the cerebellum has a positive influence on the tone. The reflexes in case of Parkinsonism may be absent or normal. In case of a cerebellar lesion, the reflexes can be diminished. Improper movement time and reaction time is a very important time. So when I say movement time, that means how much of time that is taken to execute one particular task is movement time. From the moment instruction is given, how long it takes for the patient to initiate the task is called as the reaction time. I ask a patient, now you touch your nose. When he starts initiating his hand to touch his nose, that is called as the reaction time. Always remember, movement time and reaction time will not be diminished, it will be increased. Most of the time, even knowing the process, many students used to make the mistake. When I ask them in the examination, what happened to the movement time and reaction time in Parkinson's? Sir, they are all diminished. That should not be the answer. They are increased. Okay. Lack of coordination in case of cerebellar disorder, and occasional sensory problems. It is not very common. It is very rare sensory problems in case of a movement disorder. Tremors will be there. You have two types of tremors. One is an intentional tremor and another one is a resting tremor. It's a very important differential diagnosis in case of this thing. So what is resting tremor? When the patient is having his hand rested, that time he will have small tremor like this. But at the same time, when the patient is moving his arm, this tremor is going to disappear. Okay, that is called as a resting tremor. This happens in case of a Parkinsonism. So don't write that I am going to treat the resting tremor in any of your management, because this resting tremor is not going to affect your functional activities. Simply, it disappears when you start moving. And there are states that this resting tremor keeps the muscle in a. It helps in patients who has tremor have a good quality of movement compared to patients who do not have tremor. That is a study. Whereas the next thing is intentional tremor. What is intentional tremor? In case of a cerebellar lesion, when resting, the patient will not have any tremor, but once he's he will have all sort of tremors in holding on to object, and the tremor quantity of the tremor can be high in case of a great lesion of the cerebellum. So here the problem happens when the patient is functioning. The functional task can be affected, so you really have to interfere with the tremor, and you have to reduce the amount of tremor in case of a cerebellar disorder. That is called as a intentional tremor. So resting tremor and intentional tremor will tell you whether the patient is having basal ganglia problem or the problem is with the cerebellum. Next is, the patients may have some speech disorders which are not like the upper motor neuron lesion. You will have articulation problem. That is, when the cerebellum is involved, the patient will have dysarthria, where the content of speech will be good, but the articulation, that is how he combines words together and spill them out, that problem. In case of Parkinsonism, you will have a problem of difficulty in speaking in different modulations, monotonous pattern. So those type of speech disorders will, in terms of, you have memory. We saw that there is a good amount of memory storage for the basal ganglia for movement memory. So there will be a problem with memory, in case of which it results in some cognitive problem. Here also restrictive type of lung disease can be there because of the rigidity of the respiratory muscles, balance disorder, gait, fascinating gait, or ataxic gait can be present. and functional loss will be more, and it will be progressive, and it is going to be tough for the therapist to manage. Got it?